Hey guys, welcome to the COVID Matters Summit. Glad you're here today.
Hey, thanks for having us on board.
Yeah.
Appreciate you taking the time to talk to us, Emily.
Yeah. So today we have David Olney and Rosie Dixon from WNY Fighting COVID. And I'm so excited that you're here because of the amazing things that you're doing. I just want to remind people the purpose of the COVID Matters Summit is to give people ideas of what they can do in their life today to make a difference in their health and the health of others and just helping each other out as a community. And rather than focusing on the things that aren't in our control, we focus on the things we can do and then take action in those areas. So you guys are doing that. You're crushing it. So I want to talk to you about what that is. So WNY Fighting COVID is a new organization that you started recently and within the past few weeks, right? Like maybe a month ago.
Yep, we started, it was just about a month ago, and it's been growing steadily ever since. We're a group of makers, engineers, medical professionals in the Rochester and Buffalo area, and got together and decided we wanted to do something to help fix the shortage of PPE in the region.
Awesome. So tell me a little bit about your backgrounds and how you got involved with this. Because we all know there's been a shortage of PPE, not just in our area, but throughout the entire country and different parts of the world. So rather than trying to figure out supply chains and different things, you're just creating a new supply chain of people in their homes with what they have and making a difference. So sorry, I'm going to let you talk now. Tell me your background. What did you do and how does it have anything to do with this or not? And I'd like to hear from you.
Absolutely. Yeah, so I'm an engineer by training. I did my undergraduate at RIT in chemical engineering, and I actually recently went back to school. I'm currently getting my PhD at RIT in microsystems engineering. So I'm kind of in that academic world right now.
Mm-hmm.
And my focus is on 3D printing. So, I work in a state-of-the-art 3D printing lab at RIT, and we've got some amazing equipment. It's a lot of fun to be there. But because of that, I was exposed to a lot of these news articles that everybody's been sending my way of, oh, did you see somebody 3D printed a mask, 3D printed
Right.
this and that? And I was, to be honest, I was kind of hesitant to get into it at first because knowing some of the challenges with 3D printing, I thought there were better solutions out there. But as things progressed, it became pretty clear that 3D printing had a place in the solution. So it was able to meet the demands for certain types of PPE. You might hear people still 3D printing or trying to 3D print the respirators. And so we're really trying not to go into that route, right?
I've
So
even heard the tubes, right? Some of the breathing tubes or things, some of the those types of things even. And I have a hard time imagining how that's even doable with the 3D printer. The flexible material of that. I think of 3D printers being very rigid, mostly the materials that the ones I've seen.
Sure. Well, yeah, so most of the materials, without getting into too much of the details, most of the materials you print with at home tend to be pretty rigid. But there are quite a number of different types of printers out there in the market. And that it just so happens the one that most people are familiar with are kind of like those ones sitting in the background over here. They print in hard plastic, and they do that really well. There's a couple options for flexible, but not too many. But there are many other processes out there that are more capable than what I have here in my home office. So I'm not surprised that some people are trying to go down that road. I've been in the FDA world before, working as a medical device engineer, and I know the challenges that come with trying to get FDA approval. So that's another thing we wanted to try to avoid if we didn't have to go down that route because it slows everything down.
Right. Yeah.
So many of the designs that we've been working with come from the recommendations from the NIH. So they've actually put out designs that say, yep, these are okay to 3D print. These are either under review or have been accepted for emergency clinical use.
Great. Great. So Rosie, do you want to tell us a little bit about your background and how you got involved with WNY fighting COVID?
Yeah, so I've been a personal trainer since 2013. I grew up in the Rochester area, and I trained there for a few years before realizing that I wanted to go back to school. So now I live in Buffalo, and I'm a student at UB. I obviously had a passion for health and fitness when I came into Buffalo, so I went into the public health program at UB, which is relatively new there. But I was able to focus on things like community health and providing services to people who may not have access or don't have the information available. So that's something that I try to bring to WNY fighting COVID. Like I said, I'm a trainer, so I'm here in Buffalo. I've been training here, and our gyms were shut down. Everyone's gyms were shut down, so I've been furloughed, and I have a whole bunch of time on my hands and a passion for community health. So I'm trying to bring the public health perspective to our team. Like Dave said, we have a lot of engineers. So I try to reel them in a little bit sometimes and bring them into more of a public health perspective, a community health perspective, and trying to look at everything in terms of healthcare systems and how those things work. And even like Dave was saying, he was talking about more flexible materials and different types of materials that we're using for these 3D prints. And where that gets difficult, like he was talking about with the NIH, is, we're trying to supplement medical supplies and medical grade materials, and that's been one of our biggest barriers. So I'm just trying to bring some perspective and context to the team about those issues.
So Rosie, you're doing some community outreach, getting people on board with, finding out where the needs are and where the supplies are and making those match, which is basically what the organization does. So let's talk a little bit about what the organization does. David, can you give us an idea of what is the mission of WNY fighting COVID, and how are you accomplishing that? What are the action things you're doing to accomplish that mission?
Yes, definitely. So our mission is to basically act as the bridge between people who are trying to help and want to help make things to support our medical professionals and the medical community. So, we've got two target audiences that we want to help support: the healthcare facilities throughout the region and essential businesses, especially as we start to talk about people going back to work and the economy starting to open up. We want to make sure that there's enough proper PPE, personal protective equipment out there for these people, for these individuals going back to work. But most important are those healthcare professionals. If they get sick and if they go down and if they're not able to fight our battle for us, there's nobody else there that can step up and take their place. So, especially my wife, she works at Strong Memorial Hospital at the Flauma Institute. So she's there every day, and she's not necessarily sure who's been exposed and who comes in contact with her. So our mission is to support those people who are going out there and putting their lives on the line.
Yeah, that's great. Yeah, so finding things that people can make. And so tell me, what are those things that I know that your website, WNYfightingcovid.org, gets you to the website where you can see some of these things where they have plans of, so they're not just asking people to make a mask or make, certain that, they are, but they're giving you plans and you're giving specifics to people so that they have something to follow and you have some standardization in the process of what people are creating. So tell us about some of those things that they can make at home.
Yeah, absolutely. So you hit the nail on the head. We want to really try to focus on standardization, and it's not very useful for healthcare facilities if they get 50 different variants on the same type of design. So we want to provide some level of consistency. So that's really part of our core competency, is to be able to find those designs and put them out there and try to get everybody on the same page. Not just in 3D prints, but in fabric masks, One of the things we're working on right now is a fabric mask with a clear liner in the front. There's a large population of deaf and hard of hearing people here in the Rochester area. And so some of the feedback that we've got is, maybe you go to Lowe's or something like that, and you see people with their employees with their masks down. Well, why are you doing that? Well, my coworker can't understand me otherwise. So it's not necessarily for the deaf or hard of hearing person to wear, but it's for her coworkers or his coworkers to wear, to be able to effectively communicate. So, things like that.
That's a great, I know my uncle has not COVID. He was tested negative for COVID, but had pneumonia. And so was in the hospital and intubated, and, it sounded like COVID when you hear it, but it was pneumonia, not COVID. But he is hard of hearing. So he wears hearing aids, and even with his hearing aids can't hear very well. And so he had a really hard time at first when they first brought him in, and he called 911 and they had him in the hospital. And so they put him in a coma. He wakes up from the coma, and they thought he was mentally deficient because they didn't know about his hearing issues, and he couldn't hear them because they all had masks on, and he's used to reading lips. This is a lifelong hearing issue he's had. He's used to reading lips, couldn't read their lips. So there was some communication difficulties there. So sometimes, you don't even know who that might be affecting. I myself rely on watching people's lips move when they talk. I also have hearing issues, not nearly like my uncle, but it helps me to see someone's face. So I'm a little anxious about going out there and not being able to hear people, right? Or understand them, because that helps with my understanding. So I love that you're talking about looking at that option for people to have masks with a clear. What would the material be made from, potentially, for having a clear, so you could see someone's face?
Yeah, so we've looked at a couple different options. We haven't quite settled on anything yet.
Yeah.
We've got our sewing expert is kind of pursuing that. I know she's looked at variants on either commonly accessible materials like shower liners, or I believe she was looking at halyard material, like at the dentist's office. And I think that I'm gonna mess it up if I try to go for it, because I know that's not clear. So, but I know
it seems like the clear options wouldn't be very breathable, though. So there has to be some way to make them
essentially
breathable.
there's a window surrounded by breathable material.
Okay.
So the whole mask isn't made out of that clear material. But you're absolutely right.
Yeah. Wow. I'm sorry. And I went on a tangent there because I was excited about those masks. I hadn't heard about that. No, I hadn't heard anyone talking about that. And I know it's an issue that I'm glad there's people thinking about that and working on a solution for that. So thank you for.
Absolutely. And like you said, go ahead, Rosie.
I was just going to say that I think it's a totally awesome tangent, because, I mean, when we talk about issues that people are going to have reintegrating back into society, when we open everything back up, people are still going to be wearing masks, and there are a lot of social cues that we miss because half of our face is covered. And I think that it might be helpful for some reintegration when we do start to open things back up here pretty soon.
And what better place than Rochester, New York, right, to be thinking about this, because we have a huge hard of hearing community. We have the National Technical Institute of the Deaf with RIT, and we have I can't remember the name of the school, the Rochester School for the Deaf, right? So we have a large community here of hard of hearing folks. And so that's, it makes sense that idea would come from here. I love it. Yeah.
And we're by no means the first to think about it, but we definitely want to be the voice to propagate it here throughout the region. And the same thing with the mission of WNI Fighting COVID. If you look around the country, there's other groups. We got our inspiration from some other groups around the country, Huntsville and California, who were doing this long before we were. So we're just trying to bring that to the region as best as we can. Yeah,
I noticed on your website too, there's not only plans for PPE materials and how to make those, you can also replicate a group, right? So you're giving instructions on how to do what you're doing in other places. So if you're not in the Rochester, New York or the Western New York region, you can go on there and find plans and all the ideas of how they brought this together So it's a self-replicating group, right? So they could go out and create that. They can 3D print another WNY fighting COVID, but in their own community.
Well, and that's essentially how we got started. So we want to give a big shout out to the people that came before us. And like I said, everybody in Huntsville, Alabama and California that was put those resources together that made it easier for us to get off the ground.
Right. That's great.
They did a lot of work to support that.
I love that it's a community effort. There's no competition here. There's nobody trying to do it better than somebody else. We're all just trying to come up with ideas and turn them into actual real things that are helping. So what are some of those other things? So we talked about the mask, sewing the mask. And before we hit record, we were talking about the ear savers, right? I think you have one. Can you show us what that looks like?
Sure, absolutely. So this is just a small piece of plastic. This only takes about 10 to 15 minutes to make on a printer. And this is, I gave a bunch of these to my wife to take to her department, and they love them because trying to wear those surgical masks all day long can get really, for anybody who has to do that, gets really taxing on the ears. So this just sits behind the head, and it takes some of the strain off the back of the ear and puts it on the back of the head.
So the idea is the ear loops go, connect to those instead of your ears. So it keeps that pressure off of your ears all day.
Exactly.
Yeah. That's great.
So definitely not looking at just PPE, but other things that can make supporting that PPE more effective.
Right. So you have the masks, you have the ear savers. So what else? There's the face shields, right? Face shields.
Yeah. So we are definitely not the first in the region to try to do this with face shields. You'll have to excuse me. My golden retriever puppy is trying to play in the background here. So
it's got something fun.
Oh yeah. You're done. If the other group, the other group in Rochester looking at face shields, they've been doing a lot of work with face shields, has been Face Shields Rock, and they've got about 5 or 6 weeks of work ahead of us. And they've delivered, I think, well over 5,000. I think probably over 6,000 face shields now to the region. So they've definitely know how to do face shields, and so we've just been trying to support some of the work that they've been doing. We are using the same design that they are using. So again, trying to go after that consistency in the region, and just trying to help take some of the bring in more people to support that same goal. Yeah. And I think we hit on everything except our 3D printed face masks, which are growing.
I'm interested in those. I'm interested in what those are like, and who those are intended for use.
So I've got one right here. They're not an N95 mask, but they look like one. They look similar to one. The idea here is that the plastic can be wiped down and sanitized. So right now, a big problem in the hospitals and the healthcare facilities is that most of these places are only getting one surgical mask to last throughout the whole week.
Right.
Now, in typical use, those are designed to be, Rosie, I think you can shed some more light on this, but they're single use. You're supposed to use them, interact with the patient, throw it out.
Right. As you're walking out the door, you don't even take it out the door with you, right? You just put it in the medical waste bin.
Exactly.
One mask per interaction, per cross-contamination possibility. Yeah. So, I mean, if you add up for every patient that you're checking in with, 50, 60, 70 masks a day, I don't know, sky's the limit, right?
Yeah, it goes in that red bag in the hospital, right? It says medical waste warning, you're not supposed to touch that, but people are wearing it from one room to the other when that's not what its intended use is. Yeah.
Exactly. My wife sees maybe 150 patients a day, between her and the rest of her staff or her coworkers. Her personally, I think she sees over 60 people a day. And so now you think that one mask that should have been used for one patient, now you're talking 60 people a day, 5 days a week before you get a new mask. Wow. So really the benefit here is the idea is to take that surgical mask material and you would cut out smaller squares of that material and use it as a filter as I throw mine across the floor.
You probably
So
should clean that before you use it again. I don't know.
Yeah, so you would cut out smaller sections of filter, and
Yeah.
then it gets press inserted into the mask. It's just got a little press fit behind there. And then now you've got essentially a new mask. Even though it's not a new mask every patient interaction, you're getting a new mask every day. One surgical mask can make about between 5 and 6 of these filter squares. So this is something that can be sanitized. The idea is that it's safer. It's more, you're consuming less material in the long run.
Right. Yeah. That
And
seems
I
like
think
a great solution.
the other thing that they do too is there's a heat molding process that you can use to heat mold it to your face, and that is
Right.
creating a much more effective seal. And when we have a more effective seal, we have less things going out into the environment, and less things coming into us. So so if you can get that seal right, I think it's going to be much more effective.
What is the process for heat molding? I think of like putting a hair dryer on my face maybe, or do you like boil it in hot water and then, what is the process to heat mold to your nose and to your face?
Yeah, it's just like if you've ever heat molded a mouth guard, same process. So you get some boiling water, 10 to 15 seconds. You dunk the mask in the boiling water. You take it out, let it cool a little bit. So it can take a few times to get the right timing, so you're not burning your face. But
right. I have to say I've been a little worried about either burning myself or messing it up so much that I completely ruin it, and then I don't have the thing. What is the chance of that happening? Do people ruin these as they're trying to get the perfect fit?
These can be molded over and over again.
Okay.
So there's no chance of. Do you want to be?
Hello there.
You want to be on the podcast?
Yeah.
All right, thank you. So yeah, you can mold them over and over again. There's no chance of messing that up.
Okay, well that's good. So it doesn't completely melt it; it just makes it more pliable to fit better. Okay, great. Exactly. So tell me, okay, so somebody, let's say I do have a sewing machine, but I do not know how to use it. Really, truly. I've used it. I've been able to use it at different parts of my life, but it would take a lot of relearning to do anything. And I'm not really feeling like I could do the mask thing.
I got to be honest, Emily, YouTube's a great resource.
Okay.
I'm going to call you out on that.
All right. Well, and I'm a smart enough person that I probably could figure it out if I could put my brain there long enough. My dad always said I was mechanically inclined, so I'm sure I could figure it out. Okay, so I have a sewing machine. I'm willing to watch some YouTube videos. I go on your website and I find this little, I have it right here. There's instructions, which I like it because it's one page. I feel like that's doable. It's one page of instructions. It's not 10 pages.
Overwhelming.
It's not overwhelming. It seems like maybe I could do this if I tried it. I might still try it. So that's encouraging. So I get nervous when I see all the folds and everything. You've got to fold it and iron it. Like, I don't want to go through iron. I don't iron anything as it is. Now I'm going to create something I have to iron. That scares me. But this doesn't look like any ironing is required. So I maybe could do this one. So I make the masks, and then I could sell them, or I could give them away to neighbors or whatever. And that's a good thing to do also. But if I give them to you, to WNY Fighting COVID, what happens next to those, or to the face shields I make with my 3D printer, or anything that I make that's on your website? What happens with them next? What's the process?
Rosie, you want to take this?
Sure. Yeah. So we are collecting our donated materials from people who've made them in the community. We are bringing them back to our facility, and we are sanitizing them. So usually, especially for those 3D printed ones, we're dunking them, and then we are delivering them out in full orders. So when we have enough people completed, so, we have limited amount of volunteers and not a huge distribution department yet. So we're working on that, but we're trying to send everything out in bulk. So what are we doing? Once a week order on that, Dave?
Yeah, right now it's about once a week.
That's great. So I like the sanitization thing because I think of like Dave there with your dog in the office right next to your printer, right? So people are printing with their dogs and their cats that like to sit on things and their babies that like to lick everything. And then they're trying to give it to somebody in the medical profession and maybe it's not sterilized and ready for them to use. So
Right.
you're
That's part
filling
of
that
our
gap.
value.
Yeah.
Absolutely, is
Yeah.
that we're able to do that sanitization process following CDC guidelines,
Right.
and then package them. So they're not. We can't say they're officially sterilized because some of our packaging doesn't come in as certified sterilized. But it is sanitized to the best of our ability,
Okay.
and we encourage anybody who receives these to do sanitization on their end as well. So
Right.
we have several layers of cleaning that go into these before they're actually used.
Yeah, I was watching the video on your website. I skipped through it a little bit before our call, but I saw something about they're putting them in a bleach solution before they hand them off to you. So there's like what if someone doesn't have access to bleach or the bleach solution? Are you providing that to them to do that? Or can you like just do extra sanitization at your end?
Yeah, so that bleaching solution before we receive them is really to protect us,
Right.
because we do our own cleaning process, right? So
Right.
if somebody doesn't have access to that, our process is to bag them and leave them alone for a few days.
You quarantine them.
You quarantine them.
Yeah.
That's exactly right. So
Yeah.
the coronavirus is like any other bacteria, anything else, it dies eventually, left to its
Yeah.
own devices. So as long as we leave it for 2 to 3 days bagged up alone, we then feel comfortable enough to use our proper PPE, gloves, and things like that to then proceed forward with our sterilization process.
That's what I do with my groceries. They quarantine
Yeah.
in the garage for however long until I need them. They just sit out there. Yeah.
Yeah,
So
and
you're doing
it's
the
a
same
good way.
thing.
If you don't have any other cleaning method, it's not a bad
Yeah.
way to make sure that your materials you're handling are clean enough,
Right.
safe enough.
Yeah.
Mhm.
Yeah. Good. To get to that next level where you then really sanitize them even
Right.
further.
Right.
Yeah. Great. So then the things come in, you sanitize them. I read something too. You said you finish and sanitize them. What is the finish part of that? Is that like taking the little extra pieces off from the 3D printing? Do you do all that? Sometimes if anyone's ever 3D printed anything, there's little pieces. I actually have a 3D printed thing that the one thing that we 3D printed ever, hold on. Okay. It's the letter O. See that?
Oh yeah, yep. All
but
those
we never finished it. So there's all these little pieces. So the O is here, but
Right.
then there's all these little pieces that we never finished. So it's taking those off. So these are the supports as it's printing.
Correct.
To keep its shape as it's printing, but then you have to remove those. So like you snap them out or sand them down. So there's a finishing process. Is that what you're talking about when you say you finish them, or do you expect them to come in with the pieces taken off?
So we aren't doing that, mostly because the designs we have out there on our website don't require supports, so you can print them without any of that.
Nice.
Now I hesitate because if we did have something that required supports, it would be a huge help to us if they were removed before we received them.
Yeah.
That's not.
That can be. I mean, I've never
difficult.
done this. Like the molding thing. I'm afraid I'm going to break it and it's going to be ruined.
Sure.
So it's beautiful the way it is. So we just
fair enough.
Yeah.
Yeah. So everything that we have doesn't require supports, which cuts down on the amount of material that's required to make these things.
Sure.
So you talk about supply chain. You mentioned that earlier. One of the challenges in the 3D printing supply chain right now is places or people like us all over the country are doing the same thing. So there's a huge demand on materials that go into feeding 3D printers. So those are becoming harder to get. And I mentioned, I think before the call, that it's actually harder to get a 3D printer right now, especially some of the lower end ones. So, unfortunately, if you don't have one right now, it is a little harder to go get those. But we want to make sure we're not wasting material. So when we say finishing, what we're talking about is either for the face shields that require a transparency to put over the front of them. So
Okay.
what's printed is just a headband. I don't have one here, otherwise I'd show you. It's just a headband with, I think, 6 clips in them. So we take care of finding transparencies, sourcing the transparency material, and then punching the holes,
Okay.
and then either putting the transparency on the headset, or providing the end user both of those pieces so that they can just snap it into place.
With instructions, yeah.
Absolutely, absolutely. For
Nice.
something like the Montana masks that we've been printing, these, you know, this is my personal one. I just use rubber bands on mine, but for anything we hand out, we either are using elastic that we're sourcing from somewhere, or you know, if the person that's receiving them wants a rubber inliner on these, we're taking care of adhering that to these as well.
Nice. Yeah, I saw somewhere a face shield 3D printing plan. I haven't read through what your requirements are on yours, but a lot of times, because you're not doing the face shields. You're doing the printers are printing the band, not the shield part. I had read somewhere where people are making them with pop bottle plastic, right? So, I mean, so if there's a shortage on materials, can people create their own? Like, can they melt down their pop bottles or something? Is there a way to make your own? Because usually it's a string, right? It's like a plastic string that feeds through the 3D printer.
Yep.
That's what I'm thinking of. Can you make your own plastic strings from the parts that you snap off at the end, like the finishing pieces, or like reuse other plastics?
Yeah, you can. It's not trivial, and it's not easy. So it's definitely an advanced level. You know, if you've been into 3D printing for a while, and that's its own hobby. It's its own expertise all on its own. So it is possible. There are a lot of places out there that supply recycled 3D printing filament, as it's called. And you can do some of that at home. Unfortunately, the equipment, if you wanted to buy that, it's about $1,000 to get that started.
Okay.
It is some specialized equipment.
Yeah. So let's say I don't have a sewing machine, or I'm unwilling to use it, or I don't have a 3D printer. So I don't have any of those things. Can I still help? Is there a way that I can help WNY fighting COVID without, if I don't have the equipment or the skill, what could I do instead to help?
Rosie?
You can go to our website and fill out a volunteer form. We need volunteers to do things like the drives that we're talking about when we're bringing people all together to drop off the materials that they've made. We'll need people for sanitization and delivery. So yeah, if you have the extra time, I would absolutely encourage you to go to the website, fill out our volunteer request form, and we'll get back to you with some instructions.
Nice. What are some of the organizations that are coming to you that are asking for, so the idea of WNY fighting COVID is you're matching the makers, your matchmakers, get it?
Yeah.
You're matching the makers with the people that need them and doing that in between stuff. But on the other end, so people can volunteer, but on the other end, they can also request materials if there's a need. And so what types of places are you getting requests from, or would you hope to get requests from?
So originally when we started, our main goal was to help supply PPE to medical professionals. But as the supply chain started to close a little bit, and we realized that medical grade materials, especially right now during a pandemic, it's really hard for us to manufacture that and make sure it meets all the guidelines. So we're encouraging, we wanted medical personnel at first, and some people are still coming in through the request line as medical personnel, especially support staff, people who aren't necessarily provided a mask for their job, even though they may work for, University of Rochester in some capacity or another. And we're also looking at essential businesses who are starting to open up. So anyone who has an essential business, you're having a hard time getting your hands on PPE so that you can outfit your employees and make sure they're all safe, definitely contact us and request some supplies. And then the other one I'd like to add to is at-risk households. So if you have someone in your home, like my mother, she has an autoimmune disease, she's high risk. So she works at the University of Rochester as a support staff, and I asked her to to request one of the Montana masks so she can get that complete seal or closer to complete seal.
Sure.
So we're open to anyone who wants supplies and is having a hard time getting their hands on them, because this is all donation based for us. We are donating all of this PPE. We're not selling it. So if you're having a hard time getting your hands on it, go to our website, fill out the request form.
That's great, because I know there's a lot of people that, I know for me for a while, and I was talking with Dave about this before our call. I had someone make masks for me, and I, bought them from her. They're too, they smush up my nose, so they're too small on my face. And my son, they're falling off, and they're great masks. Like they're well sewn. They've got the little pipe cleaners in them to keep the seal a little bit better. They're well-made masks. They're just not my right size. So I'm trying to figure out, she did offer to put new elastic on them. So I may do that, but I thought, it's not easy for people to get those things all the time. And if you're not, you can't just, I've seen more things available. If you go to the store, I saw something where Wegmans was selling them in a bin. But if you're not out and about wearing them, you don't have a mask to get out there and see those things, you may not be finding them. Right. So it's just that getting them to the people that need them. So my son said to me, well, Mom, why don't you just wear my mask? Cause mine's too big, and I'll wear yours cause yours is too small. And I went, honey, they're the same mask. We just have different heads, so.
I like where his head's at though. That's a good thing, out of the box thinking. I like it.
Yeah.
Now, on that note, for anybody, especially individuals looking for masks, especially if you're not at risk, but you don't have access to a mask right now. I know a lot of towns and villages, especially around Rochester, are starting to do handouts. So I know here in Hilton, I think it's coming up, maybe this coming weekend, they're doing a mask drive. So you would pull up, they hand you 4 masks. I think it's 4 masks per person. I'm not exactly sure, but check with your town or your village. They might be handing out the surgical masks. So not necessarily the fabric ones, but.
Right. And I'm wondering about those too. Tell me if this is what you can talk, do you speak to or not, but these are questions I have about masks, right? So, okay. So they're giving out, one of the things I heard was, I thought it was the city of Rochester maybe, was sending out 5 masks per household. They were mailing them to people, along with some information about how to stay safe and resources for mental health and physical health, and trying to give people what they need. But that's 5 per household, because I have 2 in my household. Some people might have 7 in their household. Even if I only have, I have the 2 in my household, we have 5, if we get 5 masks, like we talked about with the nurses going around all week with the same mask. What do you do when, how often do you need to change that mask, or like, how do you sanitize like one of those surgical masks that's meant to be used once, and it's pretty flimsy material, honestly. Like, can you, if you had Lysol, can you spray it? Can you wash it? Do you just hang it in the sun for a couple of days? I'm just wondering, like, practically, how are those masks meant to be? I mean, they're not meant to be used that way, but because we don't have a choice, and are they better than nothing to wear wear that surgical mask again after some period of time? Or what are do you have any guidelines for people in that area?
Yeah, so I'm by no means a medical professional, and I'm not a specialist in that, but I know my wife's, her policy through work is to take their surgical mask, they place it in a paper bag. Now it's important that it's a paper bag and not plastic.
Okay.
That'll allow it to breathe, so it doesn't
Sure.
harbor any moisture, and you're not growing any additional bacteria.
Yeah.
So it's essentially quarantined in a paper bag overnight at the end of her shift.
Okay.
So if you're only going out, once a week or so, use that mask, put it in a paper bag, put it aside. Things will die off on their own, and then you should be okay to use them again. Now, a second thing on that, masks, their purpose in the medical field are very different from the purpose used by the general population. I think it's a pretty common misconception that these masks are meant to protect the mask wearer,
Right.
when in reality it's quite the opposite. The coronavirus can spread without having any symptoms, so it's you can transmit asymptomatically. the masks are really to prevent you from spreading the bacteria or the virus, the virus to other people, right?
Right.
Through aerosolized particles. So there's some confusion about it, but essentially, if two people are wearing masks, there's very little likelihood that those tiny droplets of moisture that come out as you speak will get through that mask and through the other person's mask.
Right.
Even though they're not filtered to the proper level as an N95 or something like that.
Right. So the N95 are not necessarily necessary when you're walking down the street or when you're at the
Right.
grocery store. It's more if everybody's wearing a mask. I saw a really interesting meme, illustration of this, where if the person has the COVID virus is wearing a mask and the other person is not wearing a mask, there's still it reduces it by maybe 70% or something, right? So, but if the person, I'm going to say it all wrong, but in the end, if both people are wearing a mask, it's like 0.1% or something. It's like ridiculously lower if everybody's wearing a mask. So It's not so much, but the biggest drop in transmission is when the person that has it is wearing the mask.
Right.
But to get that extra protection, so you drop from like 30% risk to 1%, you also have a mask.
Exactly.
Yeah.
Exactly.
So you're protecting other people, but you're also protecting yourself.
Right.
So, yeah.
But now there is also a lot of misconception about the safety of masks and why they weren't immediately recommended for use by the general public. And, you can wear a mask and wear them incorrectly. And, if you're touching the mask and then going under your mask to touch your face or taking it down below your face. One of the biggest modes of transmission is actually touching things that are contaminated and then touching your face. So you want to make sure that you're being very careful with that mask to not touch your face as much as possible. And you don't want to have a sense of comfort, a false sense of security.
False security, right.
Exactly. So you still want to be social distancing. That's going to help minimize not touching your face, having everybody have these masks on to reduce that cloud of particles, and keeping that social distance. I don't remember if I said that already, but you want all three of those things will keep everybody the most safe. Absolutely.
Plus, I think if you're wearing that mask, it's a reminder not to touch your face.
Should
right?
be.
Yeah, it's like another little cue, right? Yeah.
Absolutely. No, I know it is a habit for a lot of people, so that habit can be hard to break, though. So,
right. Well, it's something we all do. It's just, every animal does that, right? We're no different than any animal, and they scratch, we scratch.
Oh,
yeah.
Well, especially when you've got a foreign thing stuck to your face all day. You want to touch it.
Oh yeah. I know I'll be in the car with my son. I say, I can't stand it. I want to, scratch my face. And he's like, don't do it, Mom. Don't do it. So we talk about it when we say it out loud. I feel like scratching my face right now. And so I say it instead of doing it. And then eventually just forget about it and I'm fine.
And those are great conversations to have with your son too. Don't feel like you have to be in this fight alone. Share those with everybody else around you. And I'm sure people will get a laugh out of it, and it helps encourage them at the same time.
Yeah, I make sure I say those things out loud so he knows that he's not the only one there dying to touch his face.
Right.
He's like, oh, Mom has that problem too, and then we laugh about it. Yeah, it's great.
Well, you're talking about it so much now. Now I got the itch.
Oh yeah, does your face itch too, Rosie? You're like,
yes, absolutely.
Yeah. What else can you guys tell us? Anything else that I didn't ask yet that you'd like to go over regarding anything?
So you mentioned other ways for people to get involved. And Rosie had a great way that people can get involved if they don't have a sewing machine and they don't have a 3D printer. The other thing, if you're not willing to go out and be present, either be at our facility or drive for us, we're looking for donations, and we're looking for materials. Like Rosie said, everything we give out is 100% free to the recipient. So we're trying to source materials.
So someone has a printer and a sewing machine, but they don't have elastic, they might be able to get those things from you.
Yeah, so
if
we're
you're able
also
to source those and get donations.
exactly,
Yeah.
exactly. So we're doing some of the finishing, but we can also help provide materials to our
Nice.
volunteers that don't necessarily have them. So we are looking for those donations. Right now, we're in the process. My brother, who's handling our financials, likes to say that nonprofits don't usually get started in a couple of weeks in the middle of a pandemic. So
What?
we so it's been challenging for us to get that part of our business set up. And I say business because we are a New York State nonprofit, and we are seeking federal 501c3 tax exemption. So that paperwork tends to take a little bit longer. But I think just as recently as last week, we got our incorporation documents, and we're starting to go down that road of getting our bank account set up. So if you don't see that donation link up on our website yet, check back soon. Things are evolving rapidly.
Nice. And so I'm guessing, so you can donate your time, you can donate your money or materials, supplies. You can also, I guess, donate a link, right? So
Absolutely.
Link to this video, share the WNYfightingcovid.org website so people can see what you guys are doing. Any part of it.
Find us on Facebook. We're on Instagram. We're on Twitter. We're on all those. So join us online on social media and help us share our posts. That's a big way to get information out.
Yeah.
Absolutely.
Awesome. Anything else? Or I think we covered a lot. I'm really grateful that you're doing what you're doing. I love hearing stories and I just have to mention too, you're both students, right? So you're not like these, pardon me, I'm sorry. You're a little younger than me. But you also are, you're not waiting to have a career, to have like a full, you don't have these big corporations behind you or whatever, you're starting with what you have. And that's all that any of us can do. Is it doesn't matter what your background is. It could be a hobby in sewing. You don't have to be a master seamstress. You can just have a sewing machine and watch a couple of YouTube videos. I still might try this mask here that you have on your site. I think I will try it once. We'll see the results. But so it doesn't matter what your skill level is or what your background is. You can make a difference if you want to and find the way that you can do that and keep yourself healthy and keep all your loved ones healthy and everyone that they touch and that you touch in your life. So, yeah. All right.
Thank you very much.
Yeah, thank you so much for having us on today,
Thanks
Emily.
for being here.
Really appreciate the time for you to help get our message out and help us coordinate the whole region.
Great.
We're not looking to just support Rochester. We're trying to get out to Buffalo and the Finger Lakes regions as well. So reach out to us, contact us on our website, on our social media, and check out those designs. Emily, that mask was designed to take 5 minutes to sew. So
I read that and I went, it might take me like 10x that my first time at least. Yeah.
You'll get better, I promise.
Yeah, that'll be my goal, 5 minutes, after I've done 20 of them. Yeah.
Well, thank you again. We really appreciate it.
Yeah, thanks. Thanks, guys. Bye-bye.
Bye.